Our next presenter is Lawrence Lemke, Associate Professor of Geology. Larry is the Director of Wayne State's Environmental Science Program. His research investigates the fate and transport of contaminants in groundwater, air, and soil, with a particular emphasis on human health and exposure risks in urban environments. His presentation, Linking Urban Air Quality to Health Across the Detroit-Windsor International Border, a 5-year summary of the GEO-DHOC project. Larry?
Thank you. Thank you. Good morning. I'd like to begin by acknowledging my co-author, John Reiners, who is from the Institute for Environmental Health Sciences and the Center for Urban Responses to Environmental Stressors. John is the co-director of the GEODOC along with me. And GEODOC is an acronym. It stands for Geospatial Determinants of Health Outcomes Consortium. That's a mouthful. The premise behind this group is that we can map both environmental attributes and health outcomes and correlate them spatially. So our overall goal is to use geospatial analysis and models to investigate diseases and then ultimately inform policies and improve the health outcomes of urban residents. We started off by recognizing that Detroit and Windsor are a natural laboratory for the type of investigation we'd like to do. The international border is the Detroit River, which you can clearly see here, but of course air is free to flow back and forth across it. Detroit and Windsor occupy the same airshed, but they have very different population demographics, different environmental regulations, and different healthcare systems. So we reasoned that if we could identify disparities in health outcomes, perhaps then we could tease out differences in environmental policy or healthcare delivery systems that could optimize the health of residents in urban areas. So we started in 2008 with our pilot study to develop spatial models that would relate air quality and asthma in both Detroit and Windsor. The initial GEODOC team was an international interdisciplinary group of environmental scientists, epidemiologists, and healthcare delivery specialists, and geospatial data analysts. We organized ourselves into 3 teams that worked interactively with one another. And we set out to simultaneously sample air quality in Detroit and Windsor during September of 2008 and again in June of 2009. We were ambitious. We measured NO2 and SO2, which are gaseous components of the atmosphere. We measured a suite of 26 volatile organic compounds, or VOCs. These are things like gasoline components or paint thinners and dry cleaning solvents. We measured another suite of polycyclic aromatic hydrocarbons, or PAHs, that include chemicals like anthracene. And we measured particulate matter in 3 size fractions: coarse, fine, and ultrafine. This is a map that shows the distribution of our sampling pattern across both the city of Detroit and Windsor. There are more than 100 sampling points here. So you might wonder, how do you actually go about deploying 100 samplers across 2 cities in 2 days? And the answer is you employ a small army of students. Undergraduate students and graduate students were recruited from the departments of geology, environmental science, and civil and environmental engineering, both at Wayne State University and the University of Windsor. So we took those students and we gave them extensive training. We wanted them to understand the technology and the science behind the instruments they were deploying. We took them for 4 days and trained them and gave them practice actually deploying these instruments and calibrating the pumps. Then we put them through a certification program where they had to pass an exam so that they were following exactly the standard operating procedure. In the end, we deployed our samplers on light poles and on downspouts and on rooftops of fire stations on tripods. Along the way, we formed some very solid community connections with the Detroit Department of Environmental Affairs, which we continue to work with today, and the Detroit Fire Department, who took in our students, offered them meals, and even gave them some supplemental training that we did not anticipate as part of the study. I want to do that. That looks fun. We found 3 important things in the end. First, that air pollution varies on a neighborhood scale, on a scale that can't be detected by 1 or 2 large-scale community monitoring sites. Second, there were some associations between asthma and the air pollutants we measured, but they were different in Detroit and Windsor. And finally, we found that when we normalized for populations, the incidence of asthma was about 10 times greater in Detroit than in Windsor. So I'd like to show you a little bit more about each of these in turn. First, here's a map that shows the distribution of NO2, nitrogen dioxide, in both cities. The black dots that you're seeing are the actual sample locations where we took our measurements. The scale ranges from about 9 parts per billion in yellow up to 23 parts per billion in dark brown. So the darker colors are the higher concentrations. And what you can see is that the highest concentrations are in the core of the city. They're associated with the nexus of major roadways that coalesce there. And so NO2 is a mobile sourced pollutant. The pattern for VOCs is quite different. It's more complex. There are gradients throughout the city, and it reflects a combination of both mobile and point sources for this type of pollution. And if you look at particulate matter, the highest concentrations we saw were in southwest Detroit, where there's a great deal of industrialization. So, in the pilot study, we used a relatively crude way of assigning pollution concentrations to populations. We took and found the average pollutant concentration in each postal code zone. In the US, that means a zip code. In Canada, it means a forward sortation area. So we took our pollutant maps and translated them into postal code increments. At the same time, then, we could look at the incidence of asthma. This map, each dot shows a Henry Ford Health System patient that had an asthma event during 2008. And by asthma event, I mean an emergency room visit or a hospitalization coded to asthma. And we could count the number of those based on residential addresses in each of the zip codes and normalize for the population of patients in each of those. So when you do that, then you could do a crude correlation between the pollutant concentration and the number of asthma events. And in this case, we found a significant correlation in Windsor, but not in Detroit. For VOCs, we found a significant correlation for both of these cities. And you still might be wondering, though, why so much more asthma in Detroit than in Windsor? We were wondering that, too. In this picture, the concentrations look like they're about the same, but the actual asthma events are 10 times higher, if you look at the scale on the left side of this diagram, in Detroit than they are in Windsor. So when we reported these results of the pilot study in the Journal of Exposure Science and Environmental Epidemiology, we speculated that maybe this has something to do with differences in how asthma is managed in the two cities. And in fact, John Reiners and I attended a community advisory board meeting of the Center for Urban Responses to Environmental Stressors this year in January. And one of the representatives there from Wayne Children's Healthcare Access Program told us that in Wayne County, Medicaid does not pay for asthma management services. And we thought, aha, this is one of those policies that we might want to be targeting to try and influence health outcomes. So, where are we going with the GeoDoc project? We are moving from asthma into adverse birth outcomes. We're now looking at things like premature delivery and low birth weight. We're moving from acute exposure. Asthma events are triggered by acute exposures to chronic exposures. So we're interested in exposures over the first, the second, the third trimester of a pregnancy or the entire term. And we're narrowing our focus from a postal code scale down to individual scale exposures. The GeoDoc team has expanded. We have many of the same original members, but we've also recruited new members who have expertise in perinatology. And we've taken our our September 2008 and June 2009 detailed concentration maps, and we have merged them with continuous monitoring from one or two of the MDEQ monitoring sites in the city of Detroit. So now we've been able to generate a series of monthly maps that represent the seasonality of these pollutants across both cities. We've done this not just for NO2, but for BTEX compounds, for PM 2.5, that's particulate matter 2.5, and particulate matter 10. One of the most remarkable aspects of our study, though, I think, is the spatial resolution. We've been able to interpolate our pollutant models down to a grid that measures 300 meters by 300 meters. So that little white square is a 300 by 300 meter grid square. And if you look at the city of Detroit, this is the number of squares that we have that cover it. And to give you a better idea of what a 300 by 300 meter square looks like, this is a Google map image of the Wayne State University campus. And 300 meters by 300 meters covers an area that's bounded by Cass, Warren, Wayne Anthony Drive, and Kirby. So at this point then, based on the residential addresses of the patients in our database, we should be able to assign individual level exposure estimates based on that address and hopefully improve the types of correlations that we can do. So let me sum up. The GeoDoc project has resulted in a continuing interdisciplinary collaboration among local, national, and international researchers. We've been able to develop some high-resolution air quality models in Detroit and Windsor, and we have established health information databases that we can then correlate spatially with those environmental stressors. The health outcomes that we've investigated so far include asthma, birth outcomes, and maternal outcomes as well. And we anticipate increasing the amount of interaction we have with community groups, especially through the CURES Community Advisory Board mechanism, and other governmental entities so we can facilitate the type of policy changes that we're aiming for. And I'd like to end by acknowledging the funding for this project, which wouldn't have been possible without initial support from a Presidential Research Enhancement Fund grant from Wayne State University, but also in-kind funding from University of Windsor, Health Canada, the Henry Ford Health System, most recently from the Kellogg Foundation and the Detroit Medical Center, and of course our partners in this, the City of Detroit, the City of Windsor, the Great Lakes Institute for Environmental Research, and the Michigan Department of Environmental Quality. Thank you very much.